I was excited at this meeting to present on anemia and myelofibrosis, the multifactorial origins of anemia in the disease, from marrow dysfunction to impact of medications to sometimes other contributing factors such as pre-existing iron deficiency. The role of the JAK2 inhibitors, and in particular now 2 JAK2 inhibitors that can have an impact on anemia, Momelotinib that has a clear direct indication in anemia, as well as Pacritinib that can help to benefit anemia, as well as a variety of additional agents both in development such as Luspatercept and other things we historically have used to try to help to improve the anemia these patients face, such as erythropoietin stimulating agents, thalidomide, and other such agents. And then future state, as we look at new types of therapies, the deeper the impact on the disease, potentially the greater the impact favorably for anemia, but that's something that we have to see.